So right now we're preparing for those temperatures to nosedive in the overnight hours. We hit the high today around noon, and then really it's all downhill from there. The storm rolled in. Waking up tomorrow, we will likely be below zero and will stay that way for a long time. So these are dangerously cold temperatures here. And to help keep you and your family safe, we brought in 9 News medical expert Dr. Pyle Coley joining us now. Good to see you.
Hi guys.
Yeah. It's cold.
You're ready for the cold?
I think so. I mean, we've been, beating this dead horse, but it's because we care about our viewers and we want them to be informed, and that's why we're bringing you in here today. Let's start with hypothermia. How much of a reality is that this weekend?
These kind of temperatures, very much of a reality, and it doesn't always just have to be the fact that you're directly exposed to it. It could also be if you have moisture on your skin or that wind chill. That -20 wind chill can very quickly lower your core temperature to less than 95 degrees. And hypothermia can come on quite quickly, especially in our older population, and it really presents with sort of confusion, and then eventually the organs start shutting down. You can have cardiovascular collapse.
Not good.
Yeah, your heart can stop. And so you're talking about a life-threatening complication of the cold. So really we have to have our radar up for these types of things, especially if you have an elderly neighbor or someone who lives alone.
Quite literally, it is life-threatening temperatures is what we're expecting to see over these next couple of days. Talk about frostbite a little bit. That's what, a lot of people see sometimes when they spend a little bit too much time outside without gloves or anything like that. How quickly can that set in?
So in a -20 wind chill, you can get frostbite within 15 to 30 minutes.
Ooh.
And you're talking about especially the areas that don't have a lot of blood flow, like the tip of your nose, the tops of your ears, your fingers, and your toes. And again, because it's so cold out, and your body's ability to sort of regulate your core temperature, the body moves all the blood from the fingertips, the nose, the ears, to the core, because it tries to protect the organs. And so all of that goes very, very quickly. Now, if you have any moisture on you, if you're older, or if you're going, doing something that's burning off more heat and exposing your digits to more frigid temperatures, that can happen even more quickly. So the signs of frostbite to look out for, which you may not even feel: numbness. Sometimes you can't really tell when you're outside if your nose is numb or your ears are numb, but really if the color starts to change, it becomes pale, it becomes blue, or in the worst case, it becomes black. That's a sign that you're having tissue loss. Yeah.
Well, I'm curious too, because UC Health has already told us in this hour about, ages 75 and older at extreme risk. But I'm curious, are there other age groups? We've got some activities this weekend with my 4-year-old, and I'm like, I don't know, other age groups that really just should not be outside, period, in this.
Yes. People who can't regulate their body temperature as well, so older, younger people, and then our pets as well. We have to be really careful with taking them outside. Anyone who has asthma or lung disease, because that cold air is going to trigger a spasm in your airways, and it can precipitate not just inflammation, but actually the muscles to clamp down and cause an asthma attack. Anyone who has heart disease, because really cold weather has been linked directly to heart attacks and strokes, and so those blood vessels freak out when it's that cold, and they can close down and trigger a blood clot or trigger inflammation that can cause heart attacks and strokes. So these are all high-risk groups. So if you take chronic medications, if you have any chronic problems, this is not a weekend to be spending a lot of time outdoors.
Not at all. Absolutely. So obviously wearing those heavy coats, making sure that you're not spending too much time outside. But what are the best ways to protect ourselves over
So a few tips for the weekend. First, when you're dressing, you want a base layer that wicks away the moisture. Then you want an insulating layer that's down or wool, like a sweater. And then you want your waterproof jacket on top of that if you have to go outside. And then again, cover those hands, the heads, the feet, keep all that protected. But don't fall behind on the water either, because when it's cold out, our body actually triggers a response called cold-induced diuresis. It makes us pee more because those blood vessels constrict, so we urinate more. So we lose water with that, and then we don't feel like drinking, right?
Because it's so cold out, you aren't thirsty.
Yep. Yeah. So you want to drink warm water, warm beverages, soups and stews, oatmeal, porridges. You don't want to be drinking ice-cold beverages this weekend.
Okay, good to know. All good information, truly. Dr. Coley, thank you. And as always, if you want more with Dr. Coley, I know you do, go to 9news.com/Dr. Coley.